Understanding the dawn phenomenon and blood sugar regulation. During fasting, an increasingly popular practice for health and weight management, often raises a critical question. Why do blood sugar levels sometimes increase during fasting? You might expect blood glucose to decrease when you're not eating, but for some people, it actually rises. This phenomenon, while puzzling to many, is quite normal and is deeply connected to the body's internal hormonal balance, particularly the dawn phenomenon. The basics of blood glucose regulation. To understand the dawn phenomenon, it's essential to grasp how blood glucose works in the body. Normally, when we eat, our blood sugar levels rise as the body processes the food. In response, insulin, a hormone produced by the pancreas, is released to help store excess glucose in the liver and muscles as glycogen. When we're not eating, such as during fasting, the body enters a different mode. Instead of storing energy, it needs to tap into its reserves. During fasting, the body doesn't simply wait for food to be consumed. It actively releases stored glucose to ensure the brain and other vital organs have the energy they need. This stored glucose primarily comes from two sources: glycogen, stored in the liver and muscles, and body fat. Essentially, the liver breaks down glycogen into glucose and releases it into the bloodstream, which can make blood sugar levels rise even when no food is consumed. This process is regulated by counterregulatory hormones, which work in opposition to insulin. These include norepinephrine, cortisol, growth hormone, and adrenaline. These hormones ensure that the body has sufficient energy during fasting, much like how a refrigerator stores food for later use. When you're not eating, your body taps into these reserves and releases glucose into the bloodstream. The dawn phenomenon explained. A particularly interesting and well-documented instance of this blood sugar fluctuation is the dawn phenomenon. This occurs in the early hours of the morning, typically between 4 a.m. and 5 a.m., when the body experiences a surge in counterregulatory hormones. This surge prompts the liver to release glucose into the blood, effectively preparing the body for the day ahead. While this is a normal process for most people, it becomes more pronounced in individuals with type 2 diabetes. For them, the blood glucose rise can be more significant and less controlled. In healthy individuals, the increase in blood glucose during the dawn phenomenon is usually modest. But for those with insulin resistance, the body may release more glucose than necessary, leading to higher than normal blood sugar levels in the morning. Fasting and blood sugar. Why it can go up. You may be wondering, if fasting is supposed to help lower blood sugar, why do levels increase sometimes? This rise doesn't indicate that something is wrong. Instead, it's a sign that your body is doing its job, using its stored energy. Think of it like this. If your refrigerator is stocked with food, and you're taking some out to prepare a meal, it might seem like you're getting more food than you need. But in reality, you're just using what's been stored. The same applies to your body. During fasting, the liver releases glucose from storage to ensure your body has the energy it needs. And sometimes, this release can result in a temporary rise in blood sugar levels. In some cases, especially for people with high blood sugar or insulin resistance, this rise can be more substantial. It's similar to having a refrigerator so full that when you take some food out, a lot comes with it. However, it's essential to remember that this increase in blood glucose is temporary and part of a natural process. Fasting and low blood sugar. Myth versus reality. Another common concern about fasting is the potential for hypoglycemia, low blood sugar. However, the body is quite adept at maintaining stable blood sugar levels during fasting. Even when you're not eating, your body can convert glycogen or body fat into glucose to fuel your brain and other organs. In extreme cases, it can even convert proteins into glucose through a process called gluconeogenesis. Scientific studies support this resilience. For instance, a study involving men fasting for 30 to 60 days showed that their blood sugar levels remained relatively stable, even after being given intravenous glucose or insulin. Despite their blood glucose dropping to levels that would normally be concerning, these individuals felt perfectly normal. This is due to the body's increased production of ketones, an alternative energy source derived from fat. While blood glucose might be lower, the brain can rely on ketones for fuel, which is why people don't experience symptoms of hypoglycemia during prolonged fasting. Practical implications for people with diabetes. For those with diabetes, especially type 2 diabetes, fasting can be both beneficial and challenging. Fasting allows the body to utilize stored glucose and promote fat burning, which can improve insulin sensitivity and help manage blood sugar levels. However, for those on medication, particularly insulin or oral hypoglycemics, fasting can sometimes cause blood sugar to drop too low. This is because the body uses up its glucose reserves, while medication continues to lower glucose levels. If you're fasting and taking medication for diabetes, it's crucial to monitor blood sugar levels closely and consult your doctor about potential medication adjustments. Lowering medication doses may be necessary, as fasting can improve insulin sensitivity, which means less medication may be required to maintain normal blood sugar levels. Conclusion: embrace fasting with knowledge. In summary, the dawn phenomenon and the fluctuations in blood glucose levels during fasting are part of the body's natural processes. These mechanisms are essential for survival, ensuring that you have enough energy even when you're not eating. The increase in blood glucose during fasting is not necessarily a cause for concern, especially if you're healthy. For those with diabetes, it's vital to manage medications carefully and consult with healthcare professionals before making changes to your fasting routine. Fasting can offer numerous benefits for health, but it's important to understand how your body responds to it. Armed with this knowledge, you can navigate fasting with confidence, ensuring that it supports your health goals without causing unnecessary stress on your body. Keep going strong, stay informed, and enjoy the benefits of a well-balanced fasting routine.